My name is Tiffany Henry, and I'm going to be demonstrating Cvad with blood draw, dressing change, and IV medication, IV push. So I have my doctor's orders, and I have my MAR, and I am going to compare the two. And I have chest to chest, 7/19/19. That matches my MAR as well as my doctor's orders. And I'm going to give all medications in the central line using the port for all blood draws. Central line dressing is going to be done every 7 days, which today is the 7th day. So we'll be doing a dressing change. And we're going to be giving ceftriaxone 1 gram IV push every 8 hours. I have ceftriaxone 1 gram IV push every 8 hours on my MAR. And then at 1 o'clock, I'm going to convert his IV to a saline lock, flushing the central line with heparin. And over here, I have heparin IV flush, 500 units, 5 mils, and it is 500 units, 5 mils. Everything matches. So what I'm going to do now is I am going to perform hand hygiene. I am now in the medication room, and I am going to go in. I'm gathering all my supplies that I'm going to take. And at the Pyxis, I have my medications. So I'm going to come over and I'm going to do my first med check verification. I have ceftriaxone 1 gram, and I have ceftriaxone 1 gram. That matches. And then I have my heparin IV push, 500 units, 5 mils. I have heparin IV flush, 5 mils, 500 units. And this one I am going to get a second verification on.
I verify.
Thank you. So now that I have these, I'm going to take this and all my stuff into my patient's room. And I'm going to perform hand hygiene. I'm going to draw the curtain to provide privacy. Good morning, Chester. How are you today? Good? Okay, if you could verify your name and date of birth for me. Chester chest, 7/19/19. That matches my MAR. That also matches his armband. Now I'm in Chester's room. I'm going to go ahead and explain to Chester what we're doing, that we're going to be doing a blood draw, as well as when I'm done, I'm going to go ahead and change the dressing. So I have turned off the IV medications so that we have to wait for 10 minutes to make sure that when we do the blood draw, that it doesn't mess it up. So I'm now donning gloves. It has been 10 minutes. So I'm going to come over, I'm going to assess the site, and I'm not noticing any redness or swelling. Chester tells me that it is not tender whatsoever. Okay, so I want to get an alcohol wipe. And I am going to clean the port, 15 to 30 seconds. I am then going to get one of my IV pushes. I'm going to get the air out of it. I am then going to attach this. I am going to unclamp, and then I'm going to draw back till I see blood, a blood return right up here. And then I am going to do a push pause with the flush. Okay, and once we have that, I am now going to draw back 10 mils of blood. I'm then going to clamp the tube. I'm going to undo this, and this would go into the sharps container. I am then going to get a 10 ml syringe. I'm still holding on to this. I'm going to hook this up. I'm going to unclamp. I am now going to draw back 10 mils of blood. And this is the one that we're going to give to the phlebotomist so that they can run their labs. I'm going to clamp the tube. I'm going to undo this, handing that off to the phlebotomist. I am now going to get another flush. I'm going to get out the air and attach. I'm going to unclamp. And again, I'm going to draw back until I get the blood return, and I'm going to push pause. And once we have done that, we're going to clamp this back up. I'm going to undo this, and I would throw this away. Chester's having leaks all over here. Okay, so now I'm going to ask him if he has any questions, which he doesn't. I'm going to take off my gloves. Actually, I'm going to leave them on for right now, but I would take off my gloves, perform hand hygiene. I'm going to clean up my mess, everything in the trash. And now I'm going to get ready for a dressing change. So I've got my sterile kit. I have my gloves. Again, I'm assessing the site. Everything looks good. I am going to raise up the head of the bed right now, and I'm going to ask Chester to please turn his head the opposite way because we don't want to contaminate once I take this off. So I'm going to start pulling this all four corners. And we're going to do it very gently. Ooh. And this is going to go into the garbage. Okay, now I'm going to take off my gloves. I am going to perform hand hygiene. I'm going to get my sterile area ready. Checking this, expiration date's good. We're going to open this up. And I'm going to very carefully take out the mask. And we're going to put this over Chester's face, which is facing this way. I am now going to go in, and I'm going to get my gloves. And we're going to set those down. Opening the gloves. Very carefully. And I'm going to I'm going to don a glove on my dominant hand first, pinching very carefully. And I can fix that in just a moment while I go under the cuff. Just slip this in carefully. We have that one on. So now we are going to move that over. And we have our gloves. So, that, I'm going to go back into here and I'm going to get the drape, keeping everything sterile. And we are going to provide a nice little sterile field right here to protect. Okay, I am now going to go back in. And I'm going to get my chlorhexidine. And my hands are both still sterile. So with my chlorhexidine, I'm now going to unsterilize this hand because I'm going to grab hold of this, pop this, and I'm going to clean around. And again, out this way, and coming out this way. And that goes in here. And then I'm going in with my tweezers and my 2x2 gauze. And I'm going to dry this. Being very careful, holding on to this. And my trash. I'm now going back in. And I'm going to get a disc that has, we're going to put that right here. And I'm going to get, and I am now going to set this right here. I can use this hand to touch the very edge. And we are going to pull this off. Again, just touching the very edge. I'm going to place this over here, like this. Securing it down. And then we are going to take in just a minute. Okay, very carefully taking this off. Okay, so now we've got this on, everything's good. Make sure that's on nice. And I'm going to take off the extra label that I have here. And we are now going to put this right here. And on this, I'm going to write my initials, the date, and the information that I need. So now I can take off my gloves. I'm going to clean up my mess. And asking Chester how he's doing. He says he's good. So I've performed hand hygiene. I've done all my documentation on this. He's now turned his head back. He's good. And I'm going to come over because it is now 1 o'clock and it is time to administer the ceftriaxone. So I have Want to do another med check. I've got my ceftriaxone. And again, verifying 1 gram IV push, 1 gram IV push. And then I have my heparin IV saline syringe that is 5 mils. I have my heparin IV push, 500 units, 5 mils. I am going to now don gloves. How you doing, Chester? Good? Good. Okay, so because we're doing medication, I'm going to have Chester verify his name and date of birth again. And he says Chester chest, 7/19/19. That again matches my MAR, and that again matches my doctor's orders. I am now going to scan my medication into the Pyxis for my 3rd med check. And I'm also going to clean the port. Again, 15 to 30 seconds. I'm going to get my flush. I am going to make sure I get the air out. I am going to hook this up. And I'm going to unclamp. I'm going to draw back until I get a flash of blood up to here. And I'm going to push pause. I'm going to clamp again. I'm going to pull that out. I'm now going to get my ceftriaxone, 1 gram. No air bubbles. We're going to go ahead and hook up the ceftriaxone. I'm going to unclamp. And we are going to do push pause. And the reason that we clamp and unclamp is because we don't want air getting into the lines, causing an air embolus, or him bleeding out through the IV. So, clamp it again. Take that off. That would go into the sharps container. I'm going to get another flush. Again, getting the air out. Hooking it up. Unclamping. I'm going to draw back again. And I am going to push pause. And I'm going to clamp. And I am going to scan my heparin, which I have a second nurse. So we have confirmed this is my 3rd med check, as well as my verification with a second nurse. So this has been scanned in. And that does not want to come off. We have no air bubbles, which is good. We are now going to hook up this. Again, I'm going to do a little unclamp. I'm going to draw back till I get a flash of blood. And I'm going to do my push pause. once I've done that, I'm going to clamp the tube again and dispose of this into my sharps container. I am going to clean up my mess. I'm going to check on Chester to see how he's doing, make sure that he's tolerating everything okay and that there's no problems, making sure that there's no allergic reactions from the ceftriaxone, and he says he's doing great. So I'm going to take off my gloves. I'm going to perform hand hygiene, and I'm going to do all my documentation. With the blood draw, I'm going to document the assessment that I did on his arm, that there was no redness, swelling, or tenderness. We are going to document the medications, the time the medications were given, and that we did a saline lock, and that he tolerated everything well, and that's it.